Okay, while I pulled this up, I just wanted to thank everyone for being here and starting your morning off with us. I think you've got a great overview at this point of what the process of genetic counseling looks like. So what I'm going to talk about in my section is a little bit more background for you on the profession of genetic counselors and kind of what training individuals with that background may experience and what that looks like. And then I think in reality, we recognize that probably not every care team that is caring for patients with hemophilia is going to have a genetic counselor on staff. And I think what we want to do is kind of explore with you a little bit of how the process of genetic counseling that Jennifer just went over might be happening at your center. It might be able to be integrated into your center if it's not currently happening through other different kind of pathways, through other providers, through other options, because even here in the United States, the majority of hemophilia treatment centers don't have a genetic counselor with genetic counseling training providing this genetic counseling process that Jennifer just went over with you. So we're going to explore that a little bit as well. And I will just point out, too, a lot of the information that are being covered in the majority of the talks in this panel are actually pulled from a monograph that was put out by WFH on genetic counseling, which I believe there are copies of in the back. So if you're looking for more detailed information on this topic or just to have in print some of the information on these slides, that may be a good resource for you. So genetic counselors, and I think the term genetic counseling and genetic counselors is sometimes used interchangeably. So when I say genetic counselor, I think in this talk I'm referring to someone from the profession of going through school and training specifically to become a genetic counselor. So genetic counselors are specially trained healthcare professionals who have expertise in risk assessment, in genetic concepts, in genetic testing, in a variety of different genetic diagnoses and how the management, clinical history, and risk reduction prevention strategies that may be available based on the diagnosis. So just to give you a little bit of background, typically training for genetic counselors is a 2-year master's program after receiving a bachelor's degree. The variety of training that you get would be exposure to coursework in both medical information as well as psychosocial training. There's a lot of clinical rotations that you have to complete. You get experience working in a laboratory and experience working on and completing research projects as well. And then at the conclusion of your training, there's a certification assessment in order to become credentialed. And the majority of these training programs are within the United States, but there certainly are other countries who have or are currently in the process of initiating or providing training through a specific genetic counseling training program. So for example, Australia, Canada, Japan, South Africa, the UK, all are starting to or have already developed training programs specifically for this discipline. And some of the main skills that genetic counselors obtain throughout their training are really focusing on how to provide education to patients and also education to other healthcare providers. So how can we take our perspective that we're coming to from the genetics training that we have and really make that information useful and functional for our patients, but also to communicate with other providers who might be caring for patients with genetic disorders as well. And I think that's one of the skills that really helps us to start contributing to a multidisciplinary team such as a hemophilia treatment center, which is already well established. Also, a lot of genetic counselors will have the skills for advocating for patients as well, and communicating and also assessing psychosocial status. So a lot of the people in this room are probably looking up here thinking, okay, that's not really much different than the skills I would say that I have in my job. I think nurses have these skills. I think social workers and psychosocial professionals have these skills. I think for me, the difference is really what your perspective is. So as a genetic counselor, I have these skills coming from a genetics perspective, whereas the nurse who has these same skills is coming at that with different knowledge and with a different background. And neither is right or wrong, but I think we just need to kind of learn how to best utilize all of those on a team. So traditionally, excuse me, traditionally, genetic counselors will work in private or public healthcare systems or hospitals. They can deal with patients of all ages. They can work in preconceptual settings, prenatal settings, pediatric clinics, all the way up through working with older individuals as well. There are a lot of different specialties that genetic counselors can be working in, such as the prenatal clinics, oncology, cancer risk assessment, might work specifically in a children's hospital. And I think recently in the genetics field, we've learned and recognized that based on some advances that we're having in technology and changes that are occurring within the field, what the job of a genetic counselor looks like is becoming a little bit less traditional. And genetic counselors are starting to be hired by insurance companies, by laboratories that are performing genetic testing, and also by multidisciplinary clinics to provide that genetics perspective. And that's, I think, a perfect example of how within the United States, I think you're starting to see more interest in how that genetic counseling is being provided within hemophilia treatment centers. So I'm not going to go too much over this. I think Jennifer did a wonderful job of going over kind of what the role of a genetic counselor is within a specialized care center. It's not much different, but you have the luxury of being able to focus and kind of become an expert on the diseases that you're seeing in that clinic. And again, on this slide, I think knowing who is in the audience and kind of the different disciplines that work in hemophilia treatment centers, some of these things that are up here that we're suggesting maybe the role of a genetic counselor, in reality, I think are probably being performed by non-genetic counselor trained individuals. So this is in no way trying to say that only a genetic counselor can perform these roles, but more to suggest that if you were to have a genetic counselor on your team or involved in the care of your patients, that these may be some of the areas that they could have as their primary areas of focus. So, as I said before, I think ideally I would love for every hemophilia patient to come in contact with a genetic counselor. That's in an ideal world, and I don't think that that's reality for a variety of different reasons, which I could talk about at length, but I will leave it at that for now. I think in the interim, the options that we have for that are to have every clinic or every provider that's caring for a patient hire a genetic counselor. I don't think that's going to happen. There are some centers certainly who do have genetic counselors more formally involved with their clinics, whether that be that they're on staff full time or that they're contracted in on maybe a 1 day a month basis. When we know that we're going to have comp clinics for hemophilia patients, they may have the genetic counselor from a local hospital come to work at their center on that day. Or maybe establishing a relationship with a genetic counselor who is at a different facility. Maybe they can't physically come and see patients in your clinic, but you can develop a relationship with them so that if you have a patient that you think would benefit from more in-depth genetic counseling than what you're able to provide on site, you feel comfortable referring your patient outside to an external provider that you've identified and that you can kind of have that relationship with to talk about the specific implications or considerations that you might that might impact genetic counseling related to hemophilia, because not every genetic counselor has ever seen a patient with hemophilia. So, I understand the potential hesitation to refer to a genetic counselor that isn't routinely working in this area, but I would encourage that if you at least establish a relationship or identify one genetic counselor in your area, if you can, then you can kind of give them some one-on-one training and education about the disease, and they can in turn give you back one-on-one training and education about the genetic aspects or considerations that you might think of. And the last kind of path or option for what genetic counseling might look like for patients with hemophilia is that it could be provided by other disciplines that are currently on staff. And I think this is probably the most realistic, or at least the most common at this point, because a lot of what we've talked about, I think, people are already doing. It's just not being thought of as kind of the process of genetic counseling. But I think certainly in hemophilia centers that don't have a genetic counselor, people are talking about inheritance. People are talking about genetic testing. It's just who that person is may be different. So, like I said, I think often genetic counseling in hemophilia care is the responsibility or is put on the plate of someone who's not coming from a genetics background. And likely those people are going to have a lot of other more primary clinical responsibilities. So if the nurse is the individual who's responsible for providing the genetic counseling, they're probably going to be a little bit more concerned first to make sure that the patient is treating and has the dosing and, has the factor that they need on hand, and educating regarding treatment before they may be moving on to something less acute as discussing genetic counseling. So suggestions that I would have for people providing genetic counseling, or for clinics that are providing genetic counseling through other disciplines, would be to kind of just take a step back first and assess who's on your staff and who has knowledge in what, and what are their skills. And then designate who's going to be responsible for what aspect of genetic counseling. Is it going to be one person who is responsible for that whole role? Are you going to divide up between different staff? Maybe nurses cover one aspect, social work covers another aspect. But I think if you can be clear and intentional in whose responsibility is what, there's less risk that things might fall through the cracks. And then also providing staff with education in genetics. Once you identify who those individuals are, give them resources and opportunities to learn so that they can provide the services to the best of their ability. And then encourage you to identify someone near you who, even if they can't work in your clinic, genetic counselors are often very willing to kind of have conversations and provide information on a more casual basis with other colleagues. So this diagram I put up, and is actually one from the monograph that I mentioned that's in the back, is just an example of what providing genetic counseling may look like in a hemophilia clinic. So, if you have a genetic counselor, a nurse, a psychologist, or a social worker, psychosocial professional, a hematologist, there are different aspects of care and information that you're trying to communicate to your patient, but there's going to be a lot of overlap. And what it might look like in your clinic may be different than what this diagram is, but it's just really to show and demonstrate that it's not clean cut, and in no way are we saying that, there are certain things that only genetic counselors have to do, but just recognize that there's going to be discipline overlap. And I think if you're aware of that, you can really come up with a good plan of how you can provide this information in a consistent, standardized way to your patients. So I just wanted to give a little example of kind of what this has looked like at the center that I come from. So the clinic that I work in had been up and running for many, many years, probably over 20 before I joined the team as a full-time genetic counselor. And prior to that, there was not a genetic counselor on staff in our clinic. So kind of looking back and reflecting as I prepared for this talk, kind of what changes did that make? And it's hard for me to know because I wasn't there before I started, obviously. But it just kind of from when I started until where the clinic is now, what changes has it made, and what does the care that we're providing to our patients look like differently? So before there was a genetic counselor on staff in our clinic, there really wasn't a primary point person whose responsibility it was to provide the information in the genetic counseling process. So it was pretty fragmented. The physicians would talk about things, the social workers would document and update the family history, the nurses would kind of know who was pregnant and we were expecting a delivery on and make sure they had a cord blood kit. But it wasn't really a coordinated effort because everyone was kind of doing a little bit of their own piece of the puzzle. And I think what I realized when I started is that I feel like a lot of my colleagues, non-genetic counseling colleagues in that clinic, felt like it was kind of spreading them a little bit thin. So when I came and said, yeah, I can do the family histories, and they were like, oh, great, because I have all these other things that to me and my profession and the perspective that I'm coming from are much more important of a priority. The pedigrees and kind of the family history fell down on my list of things that I needed to do. And so having a person that's a point person for these services allows other providers to really focus on what their skills are and what they bring to the table. And there were also patients and female relatives who were at risk to be carriers were referred outside to have their genetic counseling and testing done if they were desiring testing, and then referred back to the clinic. And that was a barrier for some of our patients for a variety of reasons. And so now, as a genetic counselor on staff, obviously there is a single point person, and it doesn't mean that other people aren't talking about inheritance or answering basic questions, but the process and the genetic counseling that our patients are receiving, we know is much more standardized because it's being provided by a single person. So the majority of the education on inheritance and documenting and updating the pedigrees, like I said, tracking pregnancies and providing cord blood kits. We're much more proactive at this point in identifying which relatives are at risk, and has information been communicated to those at-risk relatives, because as a new staff member, that's time that I have in my schedule to focus on an area that they just didn't have the time really to focus on as intently. I'm not saying that they weren't talking about it or that there weren't efforts being made, but when you add a whole other team team member to the staff, there are things that you can provide that you weren't providing as succinctly before. And like I said, when you have someone designated to do this, other people can focus on what's more appropriate for them based on what their areas of expertise are and what their comfort level is. I think I've met several colleagues from other HTCs who have voiced that they feel a little bit uncomfortable with some of the information that they are being asked to provide relating to genetics because they haven't had that training. And I think, there's not a right answer of how to fix that, but I think the more that we are at least aware of the issue, we can try to address it. And then patients don't have to be referred off-site to have their genetic counseling and testing done anymore. Obviously, we're able to do that in-house. It's much more part of their routine care, and I think we've had a higher uptake in patients that are interested in it because it's not an extra visit that they have to go to. It's not at a different hospital where they haven't navigated before. It's just kind of part of the normal process. So in summary, for my section, I think the training that genetic counselors have is unique, but it overlaps a lot too with some of the other disciplines that are already routinely a part of hemophilia care. And providing genetic counseling and what that looks like, that process of genetic counseling is going to be very different center to center. There's not a right or wrong way, but hopefully what we're talking about today just gets you thinking about how things are being done where you are, and if there's any changes or ways that you can augment what you're already doing. And then collaborating really is the best way to make sure that the patients are getting what they need. So that's it. Thank you.